One side of his heart is operating at 19%, while the other is 18%. As a mom, my heart is still broken.
I went and got some scans done, and they noticed that I had some blockages in my vessels. I was actually kind of scared. Obviously I was 48 years old, in pretty decent condition, at least that I thought.
EvergreenHealth Monroe provides care for a number of people, not just in Monroe, but the surrounding communities. People traveling to come and get care at Evergreen Health because of our reputation, our quality care.
Monroe is really important to me because it's a community that's been underserved from cardiovascular care. And I know there's a lot of patients, and the community's been growing quite a bit. So there's a growing need to serve the population.
I'm Janice Kendall, and I'm Khalil's mom. He is an expert BMX racer. He was not feeling well at first. We brought him into the hospital. They couldn't believe that his heart function was that of a 25-year-old at the time. He had heart failure, and his heart was operating at 10 to 15%.
Khalil came to me after he had been admitted in the hospital with congestive heart failure. He had had numerous episodes of admission to the hospital.
My name is Ernie Walters, and I'm currently the Assistant Chief of Operations for Sky Valley Fire. I was diagnosed with having a heart condition.
When we initially evaluated him, we started off simple. Since he was very active as a firefighter, there weren't very many symptoms. And so we opted to try to see inside the heart what was going on. And then we found with other testing that there were multiple blockages in many of his arteries despite his young age.
It's been almost 6 months since he's been treated. Dr. Talavera is a part of our team. He's the local doctor that we are working with.
Khalil is a good case of determination, perseverance, and dedication to get better. He needs evaluation for potential transplant and other advanced services for his weak heart. He's well on his way to getting the care that he needs, and he's dramatically better.
There was a lot of emotions going through my head, because I was still young. When you're still in your 40s, you don't expect to have somebody, cut open your chest and replace your heart vessels.
Fortunately, we're able to do bypass surgery. His case is a really good example of prevention, where in someone who seemed to not have too many symptoms and then realized that there were some more major issues that were underlying it. And this is not an uncommon situation that we run into.
When community doesn't have access to specialty care, a lot of the diagnoses go undetermined for a long time, and that delays care. That patients show up to the emergency department with disease that potentially has progressed far beyond what should have. And I think that if we provide specialty care, we can actually diagnose patients early and mitigate their risk of bad outcomes.
Having a cardiology clinic close to us is important. I've become very stressed with driving, so being able to take my son someplace local where I can actually drive has been very helpful for our family.
As a first responder, we transport to this hospital multiple times a day. It's a lot easier and quicker for our patients. Time is of essence. So having the hospital here and having specialty care here at Monroe is such a huge, huge benefit. It is so vital to actually invest into this hospital because this is the only hospital that can provide quick, quality care.
Without it, I don't know where many patients would be. There's so many people with the needs that my son has.
Not only do we need more specialty services in EvergreenHealth Monroe, but we also need all the tools that will help us diagnose patients with diagnoses that they need.
It's time that we act, make a difference in this community. Together, we can partner, providing the great quality care so that patients end up with the outcomes we hope. And we never know, by some of the lives we touch here, they'll go on to touch other people's lives, and that will make the difference that we're looking for.